Okay, so I have gathered my equipment, and as the patient is walking into the room, I have provided privacy. You can have a seat over here. I have done hand hygiene, gathered the appropriate equipment. As the patient is walking in, I'm looking at his general appearance as well as his gait, making sure that there are no abnormalities noted with his gait, that he is dressed appropriately for the weather outside. Um, and then I'm also looking for any involuntary movements as he walks in. Um, so throughout the exam, as I'm asking the patient questions, I'm going to be assessing his orientation, his affect, his mood, his speech, and his behavior, making sure that it's appropriate, as well as assessing his hearing. And if he's able to answer my questions without having any difficulties, then I can assume that he can hear me. So first thing is I'm just going, as well as looking at his nutritional status, making sure that he's not appearing overweight or underweight, that I don't see any big things that stand out to me that would indicate poor nutritional status. So starting with his head, I'm looking for eye contact, um, his level of consciousness, is he awake and alert? I'm going to be assessing his orientation. So I'm looking at his scalp to start off with, making sure that it's symmetrical. I'm going to palpate for any lumps, nodules, pain, or tenderness. I'm going to feel for his temporomandibular pulse. Have you open your close your mouth. This is his temporomandibular joint, um, and this is his temporal artery. Looking at his hair to make sure there's no deficits noted, any hair loss. He does have a receding hairline from wearing a ball cap. Gonna feel his maxillary and frontal sinuses. Any tenderness there?
No.
Okay. And then moving into his eyes, I want to look at the confrontation test. So just tell me when you can see my hand.
Seen it?
And the other side.
Yep.
Okay, and then I want to look for his corneal light reflexes. So I'm going to shine the light in his eye, and I just want to make sure that I don't see any abnormal movements, and that the light reflects symmetrically off of both of his pupils. Just want to make sure that the light bounces off of both of them symmetrical. And then I'm going to have him tell me what number I'm holding up, checking his corneal reflexes.
2.
You don't look.
2. 2. 2.
Okay. And then I'm going to have him cover one eye, and I just want to make sure that whenever I cover one eye, that the other eye doesn't have any abnormal movements to it. Okay, good. And then moving on to his external structures, looking at his conjunctiva, his sclera, his corneas, iris, and his pupil size, which I looked at whenever I shine the light in his eye. If we had a Snellen chart, I would stand 20 feet away, have him tell me the lowest line that he could read, covering one eye at a time. And that would be how we do the Snellen chart. Next, looking at his ears. If I had an otoscope, I would pull the pinna up and back, looking inside at his canal and his tympanic membrane. It should be a gray, clear color. If there was a lot of white areas, I could suspect scar tissue. And also just looking again at the symmetricalness of his ears. Next, moving into the nose, same thing, looking for symmetricalness, any lesions, flaring, draining of the nose, looking to make sure that his septum is midline and not deviated. And then I'm going to have the patient cover one ear, and I'm going to whisper a 2-syllable word and have him repeat it.
Apple.
And the other ear.
Baseball.
Okay, good. Next, looking in the mouth at the buccal mucosa, his teeth, gums, teeth, tongue, floor of his mouth, his palate, and his uvula. Making sure that I don't see any lesions or masses. Have him say ah.
Aw.
Making sure that his uvula stays midline. Looking at his teeth and raise your tongue. Okay, good. And it's pink and moist in there with no lesions noted. Then I would check the patient's gag reflex. Okay, good. Next, looking at the neck, making sure that it's symmetrical, that there are no masses upon palpation or any tenderness. Feeling his jugular vein and looking for any distension. Okay, and then his thyroid and trachea. Okay, good. And then just have you move your neck side to side and up and down, looking at his range of motion to make sure that there's no area that he can't move his neck and that it all moves symmetrical. Also going to have the patient push against my hand. Okay, checking the muscle strength of his neck. Good. Next, moving on to the chest, looking at the thoracic cage, making sure that it's symmetrical with inspiration and expiration. Symmetry of the shoulders and the muscles in his shoulders, making sure that there's not one side that's bigger or smaller or one side that droops. Next, I'm going to have him take a deep breath. I'm just looking for the symmetric expansion. Okay, and can you stand up? Okay, and then I'm going to turn to your side. Okay, I'm just going to have the patient say 99.
99. 99. 99. 99. 99.
Okay, this is checking for the tactile fremitus. Want to feel a slight vibration in my hand. Okay, you can sit down. And then to check for the whispered pectorality, for suspected consolidation, I'm just going to have the patient say 1, 2, 3.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay. And then say 99.
99. 99. 99. 99. 99. 99.
Okay, and then if you'll just say A.
A. A. A. A. A. A.
Okay, and then with the echophony, if I was to hear an ah sound, then that would indicate suspected consolidation, as well as with the pectorality and the bronchophony. If the sounds were very clear, then I could suspect consolidation in those areas, but they were muffled, which is a normal finding. Next, I want to listen to his heart valves, which are going to be his aortic, pulmonic, tricuspid, and mitral. Aortic, pulmonic, tricuspid, and mitral. Counting the apical pulse here. Use 65 beats per minute, which is a normal finding. Um, Next, I want to palpate the radial and brachial folds, just making sure that they are both symmetrical, strong and equal on both sides. I'm going to have him grasp my hands, checking the muscle strength, and then have you push against my hands, push down, checking the range of motion of his hands. Have him put his arms out and push up, push down. Okay, checking the muscle strength of his arms and shoulders, and have you raise your arm. Okay, and raise your arm. Okay. Next, I'm going to look at the abdomen. If you want to take your tank top off. Okay. So I'm just looking at the abdomen to make sure that it's the contour is normal, that it's symmetrical. Also looking at his skin as I do all of the assessment, making sure I don't note any abnormalities within his skin. I'm looking at his umbilicus, making sure that it's midline, that I don't see any drainage, crustiness, anything like that. And then I'm going to look for any pulsations in his abdomen, which I do not see any. And then I'm going to auscultate his bowel sounds as well as vascular sounds. Lay down. Next, I'm going to percuss the liver border, listening for dullness until I outline the border. And then I would measure that, and then it's about 7 inches on his liver. To percuss the liver, or to palpate the liver, you can use the hook technique, the support his lower rib cage, and get your fingers underneath the bottom part of his rib cage. Have him take a deep breath. And you can sometimes feel the liver, actually the liver's on the right side, but you can sometimes feel the liver border hit your fingers. Okay, so one more time. Normally you wouldn't necessarily feel the liver. You can with enlargement, but I cannot feel his, so that's a normal finding. The spleen is non-palpable unless it is enlarged as well. So you're going to move over to the left side. Listening for the tympani to outline the border of the spleen. And then you're going to push on one side and push on the other, and do you notice a difference in pain? This can sometimes help indicate if there's some inflammation of the liver. Moving on to the lower extremities, you want to look for, you can sit up if you want to, symmetry, skin characteristics as throughout the exam, looking at the hair on his legs, making sure that that is symmetrical and that there's a normal amount of hair there for him. Looking for any varicose veins, which I do not see any on him. And then you're going to palpate the popliteal pulse, which is behind the knee here. You just are making sure that those are strong and equal. The dorsal pedialis. and the posterior tibial. Okay. Next, you're going to look at the range of motion and muscle strength of his hips, so you can lay down again. And I'm just going to have you lift one leg, okay, and down in the other leg, making sure that both of these movements are symmetrical. Then have you bend your knee up and the other one. Okay, good. And then I'm going to have him move his ankle all around in a big circle in the other. Good, making sure that both of those are able to move and that they move symmetrically. I assessed his range of motion when he was coming in. Another thing on his feet is to check his toes, making sure that he can move each one with no pain. That there's none that are stiff and do not move. I assessed his gait when he came in, but I'm going to have him stand up and just turn around, looking to make sure that his spine is symmetrical, that I don't notice any curvature of the spine, and then have him bend over. Again, looking to make sure that when he bends that his spine stays midline, that he bends straight down. Okay, you can stand up. Okay. And then I'm going to have you turn towards me. Put your feet together. Okay, look at me and close your eyes. Okay, this is the Romberg test. He should be able to keep his balance, his position with his eyes closed with no problems, and he can. You can open them now. If he could not hold that position, then that would be an indicator that he had balance issues. Going to have you lay down again, feet up here. Next, I'm going to check for the Basinski reflex. Okay. So an abnormal finding in an adult would be for this toe to flex and these toes to flare, his big toe to flex and the rest of his toes to flare out. But he was a normal Basinski reflex. So then I want to have the patient sit up, and I want to have you turn your hands like this and this as quick as you can. Okay, and then put your feet on the floor and tap one toe at a time quickly. Okay, and this is the rapid movement test. He should be able to perform these tests with no difficulties, and he can. I'm going to have him touch my finger and then touch his nose. Okay, and he should be able to do that. Okay, good. And then have you slide one heel down the shin of your opposite leg. Good. And the other. Perfect. Okay, and then next I want to just make sure that whenever that I have him close his eyes, he can tell me if I'm moving his finger up or down.
Up, down, up, down, down, up, down, up, down, up, down, up, down, up, up, down, up, down.
Okay, and then I would do this on his toes as well to make sure that there's no sensory deficits there. I'm then going to have the patient tell me if this is sharp or soft. This is checking sensation in his face, hands, legs, and his feet. So have you close your eyes and tell me soft or sharp.
Sharp, soft, soft, sharp, soft, sharp, soft,
And checking his legs.
sharp, soft, sharp, soft, soft, sharp, sharp, soft.
Okay, good. And then I'm going to check his deep tendon reflexes, his brachioradialis. A normal finding is a slight flick in the wrist as well as a flexion in the elbow, which I saw for him. Next, I'm going to check the patellar reflex. And I'll just scoot back and relax your leg. Okay, and then have you lay on your stomach. Feet this way. Next is checking the Achilles. So I'm going to pull the Achilles tight. Okay, and I should see a slight flickering. And then I'm going to check it on the sides of the Achilles as well. Okay. And that completes our exam. Thank you very much.